Okay, folks, we're going to keep rolling through this. Really excited about this afternoon as we change our focus a bit to resolving some of these problems that we're talking about and come up with action strategies. One of the things we hope to do as a part of this conference is bring action steps that we can raise tonight at the movie or after the movie, and we're having a panel. And I did mention that Lee Johnson was coming. He is here. The original, he's the groundkeepers that did the first lawsuit against Monsanto as a result of the non-Hodgkin's lymphoma that he contracted in using glyphosate. So we begin this afternoon thinking about strategies for attacking these problems. And Sarah Evans, Dr. Evans, who is a professor, assistant professor, of environmental medicine and public health at the Icahn School of Medicine at Mount Sinai. For those of you who weren't here yesterday evening, let me tell you that she completed a 3-year fellowship on environmental pediatrics and received an MPH from Mount Sinai. And her research focuses on endocrine disruptions or endocrine disruptors and brain development. And she's passionate about applying that science to protect children's health. So thank you, Sarah. Sarah's been really incredibly helpful to us in organizing this meeting, and really appreciate all you've done and are doing. Thank you.
Thank you. So I'm really inspired by everything that I've heard over the last 2 days. It's really been amazing. And I keep saying, oh, I have another idea with every speaker that I see. So it's really incredible. So I was asked to talk a little bit about the work that we've done at Mount Sinai to support communities. And I feel like I'm just going to talk for 10 minutes or so as kind of a bridge between some of what we heard this morning and over the last day about some of the scary stuff about what pesticides are doing to human health and to the environment, and to try to get you thinking into the afternoon session about steps that you can take on an individual level and also on a community level, and about forming partnerships because we have a really diverse audience here. And I think that, the issue of pesticide use is something that we can't tackle on our own. And so we really need to come together and bring our expertise and our skills and our talents to the table. So at Mount Sinai, I talked a little bit last night about how we don't really conduct our research in a bubble, right? So we have a lot of scientists, you heard from a couple of them this morning, who are doing research in environmental health. And it's just not an area of research that we can restrict to the laboratories. We take it out to the community and try to educate the public about what they can do to protect themselves. And so through the Children's Environmental Health Center and also our Pediatric Environmental Health Specialties Unit, which our director, Maida Galvez, spoke about this morning, we get a lot of inquiries about how people can protect their families and how they can make their communities safer. And a lot of these things are driven by the media cycles, right? Every week there's a new scary thing that comes out in the media about environmental exposures. Your oatmeal may be killing you because of trace levels of glyphosate. But then, we talked about this last night as well. We see these opposing messages. Ignore it. Forget about glyphosate in your food, in your beer, and in your wine. And it's not just pesticides. It's plastics. It's metals in juice and baby food. Climate change. We have a lot of emerging health issues that we're confronting. Is your couch the most toxic thing in your house, the most dangerous thing in your house because of the flame retardants? If my child plays on an artificial turf field, are they going to get cancer? And I have to say, we don't have all the answers to these questions. So all we can do is sort of guide people in the steps that they can take based on the evidence that we have, right? And so for some of these things, there's a lot of merit to the messaging and to the education that the public's getting. Others are sort of overly alarmist. And maybe some of you saw this week. Some have absolutely no correlation or causation. So this is Donald Trump claiming that the noise from windmills causes cancer. And so we have a real uphill battle in environmental health in helping people weed through all of this messaging that they're bombarded with every day. And so we have people coming to us, and some of you may be feeling like this now after all of the information that you've gotten, that you live in this toxic soup. You don't even know which thing to worry about the most. You don't know what to do. And so sometimes people just really shut down. And this leads to a high level of stress. This is partly why we actually have social workers within our pediatric environmental health specialties unit. You know, sometimes we really need to counsel families on the stress that they're causing themselves and their children, just through worrying about these things, right? And stress is toxic as well. We consider stress to be an endocrine disruptor in and of itself. So what are some of the steps that we're taking at Mount Sinai to sort of handle all of the stress that people are feeling about environmental exposures? So one is that we've made some resources available. In your packets that you received when you came in, you'll find a couple of our fact sheets related to pesticides. When we create these, it's really driven by the concerns of the community, so we listen to what people are calling us about and what people are concerned about, and we've created these in English and Spanish. So we're seated right here in East Harlem around the corner, and we have a high Spanish-speaking population. You know, we talk about access, and we really do try to get out into those communities as much as we can, and we have some mechanisms to do so. And so the other thing about educating the public is that we always want to give you actionable steps. Things that you can do both at the individual level and in your community and even globally to conquer some of these problems. Just to give a plug, we do have a website, and if you refer to the fact sheets that are in your packet, you can see that we're on Twitter and Facebook and Instagram, both through the CEHC and our Research Institute for Exposomics. So you can stay in contact with us and see all of our emerging research and information. So like I said, we want to give people things that they can act on today. And so some of them are simple and cheap and free. And this might be old news to many of you, but we haven't really talked about it today. You know, what steps can I take right now to protect myself and my family from pesticide exposures? And so what I want to emphasize about what I'm showing here is that there's actually data and peer-reviewed scientific literature to support doing these things. And so EPA did a study that showed if you use a doormat and you leave your shoes and also like strollers and wheeled items at the door of your home, you track less pesticides into your home. And pesticides can come into your home as long as a week after they've been applied outdoors. That was systematically studied. Washing your hands after playing outside and before eating. Using a wet mop to reduce dust. So I love that one because it targets a lot of different chemicals. Most of the chemicals that we're concerned about are heavier than air. So they settle in the dust, and we have a lot of evidence to show that children are exposed at higher levels than adults because they normally put their hands in their mouths. So just by using a damp mop or a damp duster, you can reduce the levels of pesticides that come into your home. And then lastly, we know from some really great rigorous studies that if you change out your diet to eat organic for as little as 5 or 7 days, you can see a dramatic reduction in the levels of pesticides in your body, and that applies to many different classes of pesticide chemicals. I put these labels up here, USDA organic, shown to have lower levels of pesticide residues, don't permit pesticide use, non-GMO project verified. We heard a lot already about the fact that GMO foods are often treated with very high levels of glyphosate. And so higher levels of glyphosate have been detected both in the raw crop and also in some packaged foods that contain GMO, soy and corn in particular. So you can shop for these labels, right? So there are a few things wrong with what I'm telling you right now. There are a few things that bother me about what I'm telling you right now. One of them is that sometimes it's prohibitively expensive or you don't have access. We just talked a little bit about access. You don't have access to things that have these labels. These certifications are expensive for farmers and growers. And so what I prefer, I just didn't have an image to put on the slide, what can be often preferable is to go to your local farmer's market, find your urban farmer, talk to them about what they're doing. They might not be advertising the fact that they're not using pesticides or that they're not using GMO seeds, but there's a very good chance that they are. And so you can equally reduce your pesticide exposure that way, as well as your carbon footprint, and support local farmers. So I probably don't have to tell this audience that, but I just want to make sure that I'm clear. And then the other thing is that telling you all what to do is shifting the burden onto you, right? And it's not your fault that your neighbors are spraying pesticides, that there are pesticides applied to your parks, that the foods that are available to you are treated with pesticides. And so this is limited. These are things you can do right now. They're proven to work. They'll reduce your pesticide exposures, but we really need to think more broadly. And so being at Mount Sinai, I was a laboratory scientist by training, and then I found out about this fellowship in environmental pediatrics that allowed you to go through the public health program after I finished graduate school. And I was totally blown away by it. I'd never seen anything like it. And so this is just an image to show you our legacy of advocating for conditions that improve public health. And so at the top is Irving Selikoff, who is the founder of our Occupational and Environmental Medicine Institute, meeting with President Johnson. And he's really famous for getting asbestos banned in this country, for showing some of the first science about linking asbestos exposure and lung disease. So that's him meeting with President Johnson. This is Phil Landrigan, who is the founder of the Children's Environmental Health Center with Senator Chuck Schumer, supporting legislation that would ban toxic flame retardants. And then the bottom is Megan Horton last month. She's a associate professor at Mount Sinai, testifying in the state of Maryland in favor of a ban on chlorpyrifos. And Maida Galvez, who you heard from this morning, I think it was in January, with Mayor de Blasio in support of the lead-free NYC initiative. So this is something that's sort of in our DNA in environmental medicine at Mount Sinai, is that we get out into the community and we advocate. And so I just want to give a couple short examples of things that we have done at Mount Sinai, some projects that we've done. And again, I want you to start thinking about where you might fit in these types of collaborative projects. So this was a project called Advocates Mentoring Advocates, a breast cancer in the environment program, and it grew out of a large grant that we had from the National Institute of Health to study endocrine disruptors as risk factors for breast cancer development. And we were able to secure a special supplemental grant to work with a community of women who were African American breast cancer survivors. And we educated them about risk factors for breast cancer. We educated them about how we do the science, what does it mean for something to be an endocrine disruptor or to be estrogenic. And then they took the information that they got from us and created a program that they took out into their communities. And they identified the communities that they wanted to go to, whether it was their churches or a local community organization or a school. They were all tied in with their own communities. And so we also partnered with an advocacy group on Long Island called Huntington Breast Cancer, Huntington Breast Cancer Action Coalition. And so we had community advocates, breast cancer survivors, and scientists all working together. And so some of the things that I learned about what could be effective was that it's really important to educate your network. Sometimes we think everybody knows that. And I find every time I go to speak to a group, even if I think they're more educated about a topic than I am, somebody has an aha moment. I've had many aha moments here at this meeting that have made me think, oh, that's something that I should try. Keeping it personal is really key. So when I testify at a public hearing, I'm often presenting a lot of heavy science, but I always say I'm a mom, and I'm a member of this community as well. Joining forces, this is a great example of how we can all join forces together. Identifying local champions. So this group, after they completed their project of going out and educating members of their communities, some of them identified an issue that they wanted to advocate for. And they approached the public advocate at the time, and they worked on standards that would improve conditions for nail salon workers who are exposed to high levels of toxic chemicals that are linked to breast cancer. So they identified an issue and a local champion, and they got legislation passed to protect those workers. And because it's my wheelhouse, I'm always really encouraging people to stick to the science. It's really hard not to overstate things, but industry will come back, and for every argument that you have, they'll have a pile of papers this thick that they think discredits what you're saying. So it's really important to maintain credibility. And then, I think this idea of arguing all the angles really applies to a lot of what we're talking about today. I'm learning so much about the importance of biodiversity and pollinators. And, I'm used to talking about children's health, but often, I might be talking to people that don't have kids or aren't really thinking about it, or, their kids are grown now, but they're a dog lover. And so that can be sort of the inroad to impact people. I am an amateur bird watcher, so when I hear about rodenticide killing birds of prey, I perk up, I pay attention. So thinking about all those sort of approaches to influence people. And so this is just a quick example of something that was really successful, and something that I think is a blueprint for how we can affect change in our community. So this is sort of the process of getting some really protective legislation passed in New York City that brought together a lot of stakeholders. So a community concern was identified that there were housing conditions in New York City that were exacerbating asthma in people who had asthma. And so that concern was voiced. We held a summit with government agencies, scientific researchers, community groups like We Act for Environmental Justice, and built this coalition, right? So we joined forces. We identified an influencer in the community, Rosie Mendez, who was a council member at the time. She introduced legislation that would improve housing standards and protect people with asthma. A hearing was held, and that's Lauren Zajac, another pediatrician and scientist from Mount Sinai, speaking in favor of this bill, and it was signed into law. And so this bill now protects people, so it requires proper pest reduction, mold remediation, and so on. So this is something that I think we can learn from here and apply to the issue at hand, which is pesticide use in New York City and beyond. And so this is a really inspiring picture to me, and this is when I first met Jay. And this is Paula Rogovin, who's in the audience, and I'm not going to tell her story because she's going to do that in a workshop this afternoon. But she is a public school teacher, a former public school teacher here in New York City. She's the reason that we're all here. I'll just tell you that. Myself, an academic scientist, city council member Ben Kalos, and of course, Jay. And so this is really exciting to me that we all were able to come together. And you see signs and artwork that were created by Paula's students. And this was a panel that we held for community members and parents at the school in support of Intro 0800, which was a bill that you're going to hear more about shortly, that would protect New Yorkers from synthetic pesticide chemicals.